Ro Khanna, are health insurance companies obsolete now? Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel.
What can we do to understand the mistakes that were made? And I think that we have to get to the bottom of this.
Yeah, amen. So let's pick up some phone calls, eh?
That'd be great.
Okay, Norma in Montgomery, Alabama. You are on the air with Representative Ro Khanna.
Thank you, Tom. My question does not have to refer to what Khanna just said. I have a thought on how we can finally get expanded Medicare for all. We have a lot of foreign groups, investment groups, and corporations who work here in the United States. And we also have a lot of international corporations. And we need to get these companies to pay more into Medicare. If they would pay 3 times what an employee pays, we could increase the funding for Medicare, Medicaid, and do this, say, for a period of 5 years to see how much we can raise to get everybody on expanded Medicare. And also, these companies have no obligation to American citizens. They do not even want to provide, most of them do not provide any type of permanent retirement funding for these people if they work for many years and then they retire. So we also need to ask these people to pay more. If an employee pays X numbers into Social Security, then the employer should pay double that for a period of 5 years. And that way we can increase the amount of money in Social Security and increase the check so that we don't have people living in poverty for all of their lives. Just like
Norma, are you talking about like the big foreign automakers who have plants in Alabama?
Well, we have some of those, but we also have like China Golden Dragon copper plant, and we have secondary and third level suppliers for auto plants. But across this country, you have things like T-Mobile, which is a German-owned company. AT&T is international. Google and Amazon and Facebook, all of these companies are international companies. And most of them are now using what are called contract employees, which have no benefits and no rights. And so in order to keep our country descending into a third world status, we need to get prepared to be able to take care of people, provide Medicare for people who have. You can't expect someone who can't even buy a house to pay $1,000 a month for health insurance. The health insurance companies are now obsolete. We don't need them anymore.
Right. So let's get Congressman Khanna's thoughts on this. Thank you, Norma.
Well, Norma, you raise a lot of good points. One of the best points you raise is that not having Medicare for all is incentivizing these companies to lay off employees and make them contractors. The reason is quite simple. I mean, companies may be willing to pay $1 million to a CEO or more and pay for their health insurance. But if there's a worker who's making $30,000, $40,000 and the health insurance cost is another $20,000 or $30,000, they say, well, we don't want that person on our payroll. So the rise of independent contractors in this country is directly related to the higher health care costs. And Debts of Despair, a brilliant book, the 2 Nobel laureate economists go into that in great detail. So the solution, as you pointed out, is to have corporations pay a tax that would fund everyone in this country having Medicare. And the ingenious part of this, as Elizabeth Warren showed, is that you could actually do this in a way that is still cost-effective for the corporations. They'd rather pay that tax to the government and make sure people have health care rather than have the escalating premiums, which is a losing battle for them. You have companies like AT&T, 20-30% of their payroll is health care costs. So this is something that, yes, there's an obligation to make sure people working for these corporations have health care, but they themselves would be more competitive if we had a more rational system.
Steve in Phoenix, Arizona, you're on the air with Representative Khanna.
Morning there, Congressman Khanna, native of Madison, and also a contributor to your campaign and many other Democrats ties to Southern California. What I'd like to dovetail off of Norma, Medicare for All is the gold standard. We definitely need that, but we also need to get the vote on Joe's proposal to do Medicare for age 60 and get that in there at least. But what I'm calling about today is I'm trying to play the long game here. We need to get a vote on statehood for Puerto Rico and Washington, D.C. Puerto Rico would be the 31st most populous state if they were in the Union. And also, D.C. has more people than Wyoming and Vermont. And lastly, your state has 40 million people and only 2 senators. And the inequities are just mind-boggling. Anyways, I'll take my answer off the air, Congressman, and thanks to you and Tom. Appreciate it.
Thank you, and thank you for the support. I agree with you on the necessity of structural reform. When you look at the number of people, Americans, who are represented by a very small minority of senators, it is staggering. I mean, it's basically the disproportionate voice to a very small population in our country and disenfranchising of large segments of the country. And so we need structural reform. That means at least ending the filibuster, which is a relic of the Jim Crow era and has always been abused by former slave states. It means giving people a stronger Voting Rights Act so that people can vote. And part of it means having people have basic representation in Puerto Rico and Washington, D.C. So I'm all for pushing for that and seeing if we can, how we get it done with the majorities that we have.
Are you optimistic that Joe Manchin might change his mind on the filibuster?
I think it depends on how much abuse the Republicans have. I mean, I think he hasn't ruled it out. So if he sees that it's standing in the way of infrastructure or something he really wants, then I do think it's a possibility.